The public has taken the pressure off our accident and emergency departments. Fewer people turned up to A&E last week than at any time over the last year. But although waiting times improved, they remain way below target because A&Es are still clogged with patients who can't get a bed until someone else is discharged from a ward. The situation at Milton Keynes Hospital is typical.
Where we struggle is those patients that need ongoing health care that don't need a hospital bed, and we see large numbers of patients waiting to access that healthcare outside of the hospital, and that's what causes the delays.
Last week across England, an average of 4,155 beds were blocked each day by medically fit patients whose discharge from hospital had been delayed. That's the highest recorded level of bed blocking ever. And here is the knock-on effect. Urgent operations were cancelled at a rate of 13 a day last month, and 362 non-urgent operations were cancelled each day on average last week, also the highest figure ever. Those are operations like the shoulder surgery John Barker finally underwent on Monday. The 83-year-old had waited 3 months for the operation, but it was cancelled, rescheduled and then cancelled again.
I think it's because there aren't the facilities for the number of elderly people or people needing operations in this area. I do feel trapped in the system because you're not getting the service that you should have, and I blame the government.
Today, NHS England praised the excellent job staff are doing. But next Thursday, some ambulance and hospital workers plan to make clear their unhappiness about how much they're paid for all that effort by walking out on strike.
It is close to the wire, but we're committed to continuing with the talks. No one's walking away from it, and that has to be a good sign.
Those talks to try to avert the walkouts will resume on Monday. The immediate crisis for our A&Es may be easing, but the growing backlog of cancelled operations and delayed discharges from hospital mean the pressure on the health service has not lessened.